The Omicron variant is sending record numbers of Americans to hospitals. It's hitting children under the age of 5 especially hard. Those kids still cannot get vaccinated, and the lack of protection is translating to more hospitalizations. Health experts say the Omicron variant appears less severe than earlier strains, but it is far more contagious. According to the CDC, the average number of new daily cases topped 614,000 over the last week. CBS News' Michael George shows how the huge jump in infections is putting a strain on healthcare workers.
In the midst of an Omicron emergency,
it is so easy to transmit that there are lots of patients that have it, but thanks to the vaccine, they are experiencing either no symptoms or very mild symptoms.
But unvaccinated individuals who test positive are 17 times more likely to be hospitalized, according to the CDC. And this is the view from St. Louis, where Denise Huffman is an ICU nurse.
We're seeing younger people die. We're seeing people dying who are leaving behind young children and teenagers.
In Florida, the Cleveland Clinic's hospitals on the Treasure Coast shifted to level red, overwhelmed by patients. Nationally, COVID hospitalizations are up in 46 states, a 40% rise from the previous week's average. The rate of hospitalization for children under 5 who are not yet eligible for vaccines is the highest since the pandemic began, doubling since last month.
The storm's going to pass. I mean, that's the great news, and what we're seeing out of other countries is that it's a fast, big peak, but then we've also seen it also start to decline fairly rapidly compared to some of the other strains.
The president Friday also offered some hope.
COVID, as we're dealing with it now, is not here to stay. We're going to be able to control this. The new normal is not going to be what it is now. It's going to be better.
The president's requirement that some 80 million employees at large companies either be vaccinated or get tested weekly faced a challenge in the Supreme Court Friday. Missouri's Deputy Attorney General argued for an injunction to stop it.
Without the injunction, rural America will face an imminent crisis.
Tell me what's irrational about rules of that nature when it is the workplace that puts you into contact with people that will put you at risk.
Citibank wasn't waiting for a court ruling. At the end of the month, its unvaccinated employees will be fired.
Michael George reporting there. He mentioned one of 2 vaccine rules that the Supreme Court is considering. It's set to take effect on Monday and would require companies with 100 or more employees to ensure all workers are either vaccinated or tested regularly. The other would require vaccinations for healthcare workers. For more on the Supreme Court arguments, let's bring in Politico labor reporter Eleanor Mueller. Eleanor, thanks for being here. Let's start with the more controversial of those rules, the one for businesses with 100 or more employees. What are the arguments for and against this rule?
Absolutely. So there are 3 main buckets of arguments because there's 3 groups of challengers. We have businesses who say that implementing this mandate would cause them economic harm. You know, they might lose workers to smaller businesses that are not subject to the mandate. Then we have states who say that they are the ones who have the authority to issue vaccination policies and that the federal government is overstepping by issuing this regulation. And then last, we have religious entities, and they make the case that this is a violation of First Amendment rights. You know, they say that if your religious beliefs are that you do not want to receive the vaccine, then it's unfair for the executive branch to issue this regulation that would, in some cases, you know, edge you towards that.
Did the justices give any hints about what the court might decide on that rule?
The arguments were very interesting. I think they were more fervent than we've seen in recent months. And they gave some indication, at least, of where they were leaning. You know, they weren't actually considering the underlying regulation. They were actually just considering whether or not to lift or keep in place a stay on the regulation. Now, it goes into effect on Monday. So there's not a ton of time for the court to act. But we saw big questions from some of the more conservative justices along the lines of things like the major question rule, as well as whether or not, you know, the OSHA has the ability to issue what is basically an emergency regulation for something that's been happening for 2 years now.
Well, the other rule is specific to healthcare workers at facilities that get federal money. Is the court more likely to allow that?
I think so. I think that they are probably going to allow this healthcare worker regulation to go into effect. There seems to be some consensus that workers in Medicaid and Medicare facilities should be getting the COVID vaccine. But my guess is, they're probably going to come out on this side of allowing that stay on the larger, broader regulation to remain in effect, while the courts have a chance to decide whether or not the underlying legality can stand.
And Eleanor, clarify for our viewers, are these arguments just about federal rules and mandates? What about state or city level vaccine requirements?
They're about federal regulation. So both of these regulations were issued by agencies under the Biden administration, and they would go into effect at a national level. Now, if they do take effect, they will preempt state and local level regulations, and then they will apply to all workers.
And the court came back early from its winter break for Friday's hearing. What does that tell you about how these justices see the impact of this ruling?
I think they understand that it's a very broad impact. There's upwards of 80 million workers who would be affected by the private sector business rule. There's upward of tens of millions of workers who would be affected by the healthcare workers rule. And because these are emergency rules, they're only going to last for 6 months. So I think the justices understood that in order to weigh in on these, they would have to do so now in a special session. They weren't initially planning to hear arguments on Friday, rather than wait until later when the regulations would already have ended.
And as we mentioned, some of these rules set to go into effect on Monday. When do we expect that we're going to actually get a decision, and what happens in the interim?
It's very possible that we get a decision, this weekend, and that would be my guess. It's not the whole rule that goes into effect on Monday. Most of it does, but companies will have until February 9th to actually implement their testing policies. So the regulation, to be clear, would require that workers at businesses with 100 or more workers either get vaccinated against COVID-19 or they agree to weekly testing and wearing a mask in their workplace. So that testing strategy, that final piece of the puzzle, employers have until February 9th to actually implement.
All right. Eleanor Mueller, thank you.
Thank you.